All right, 8:33. More than 100,000 people died from drug overdoses across the country last year. The Centers for Disease Control says that New York accounted for nearly 5,000 opioid overdoses in 2022. More than 90% of those overdoses involved fentanyl.
The drug epidemic has prompted controversial safe injection sites to open across the city. And this morning, we're going to discuss where else people can turn to for help. We're joined this morning by addiction specialist Dr. Tucker Woods of Lenox Health in Greenwich Village. So, Dr. Woods, thank you for being here this morning. Let's talk first and foremost about the emergency department at Lenox Hill, right? Have you seen over the past couple years an increase in overdose coming in?
Sure, absolutely. And one of the reasons I'm wearing purple today is because it's International Overdose Awareness Day. And because, as you pointed out, the numbers are so staggering. For the past 2 consecutive years in the United States, we've had over 100,000 drug overdose deaths, and the majority of those are from opioids. And to your question, in New York City, as an example, 1 person dies every 3 hours of a drug overdose deaths. And so we've really seen an explosion of cases, but we do have tools to fight this, and that's one of the things we want to draw attention to today.
Well, we know that there is an overdose prevention task force in this state. Is there one locally in the city that's also doing the same kind of work?
Yeah, so New York City is doing a lot of work on this, and at Northwell Health, we've partnered with New York City Department of Health and Mental Hygiene. We've also partnered with New York State Department of Health so we can get treatment to patients. The thing with addiction is treating addiction, it saves lives. Treating drug overdoses saves lives. And when you do treat somebody with addiction, it gives them hope. But and in addition to helping that individual, it helps the family. Because it's not just one person that is suffering. It's all their friends and family, loved ones around them.
You know, I spent a lot of time, I went to Vancouver to look at safe injection sites because it worked there before it came here to New York City, right? There's a lot of talk about safe injection sites, whether or not they work. And now there's this threat from the U.S. Attorney to actually shut them down. Do you believe they serve a purpose?
I think there is a big argument for harm reduction. So sometimes you have to meet the patient where they're at, and if they are going to use, you don't want patients to use dirty syringes. It would be good to, to test what they're using with fentanyl test strips. And at a lot of these sites that you're talking about, they approach the patients every day. Are you interested in stopping? We've got help that's available. So there's arguments on both sides, really.
Can we talk about the emergency kits, though, that people can access themselves? I mean, you can go to these sites where they can help people that are overdosing. But what about these emergency kits? Is that what you brought along with you today?
I brought a naloxone rescue kit with me. And actually, what's big news is starting next week, these are being shipped to big chain stores like CVS, Rite Aid, Walmart, et cetera. And they're going to be available for the first time over the counter. They should be in stores next week. And Narcan is basically a drug overdose reversal medication. And so if you know the signs of a drug overdose and you see somebody you think has overdosed on opioids, this is our biggest weapon. It'll reverse that drug overdose.
Right, and what's so important about this, if I may, is that the naloxone is actually a nasal mist, right? So it's just easy for anybody to spray it up somebody's nose and hopefully reverse.
Absolutely. So the same way you might use your allergy spray and squirt it up your nose, same thing with these kits. The big difference is there's only 1 squirt there. So with your allergy spray during springtime, you might prime it, test it to see if it works. You wouldn't do that with a Narcan nasal spray. You just put it in and you squirt.
Will this be affordable?
That's the big question, because a lot of patients have financial insecurity, and so I think it is important that it is affordable. Because you want to get as much access as possible.
Yeah, definitely a game changer, though. Dr. Woods, thanks so much for coming in and talking to us.
Thank you. My pleasure.
Yeah, important topic. And by the way, if you or a loved one is dealing with addiction, we urge you to contact the number that we have right there on your screen, 1-877-8-HOPE-NY, which is 1-800-846-7369 as well. We'll have it on our website, pix7.com as well.
All right, it's 8:38.